Today we're going to discuss what can cause scoliosis in your body. Now, if you broadly classify, you can classify it into a pediatric deformity and an adult onset deformity. The adult onset scoliosis is called degenerative scoliosis or de novo scoliosis, which means that your spine was straight initially, but because of aging and accelerated degeneration, you develop a scoliosis. That is a completely different issue. Whereas, if a person gets scoliosis while the child is growing, then we call it as either early onset scoliosis if the onset is less than 10 years, or if it is between 10 to 18 and then there is no particular cause for that scoliosis, we call it as adolescent idiopathic scoliosis. So broadly, we classify into early onset scoliosis, that is less than 10 years. Anything between 10 to 18, we call it as adolescent idiopathic scoliosis, and anything above 20, we call it as an adult onset scoliosis. Now, let us look into what are the major reasons for scoliosis less than 10 years. When your spine is being formed as a fetus in the womb, due to abnormalities which happen there, sometimes the vertebrae which are being formed may be defective, either in shape or when they have to divide into proper equal segments, they may not divide properly, which leads to either formation defects because of lack of formation or segmentation defects, and these two together constitute to what is called as a congenital scoliosis, which means when the baby is born, the scoliosis is already present. That is called congenital scoliosis. There are many forms of congenital scoliosis. We are not going to discuss on the various types, but you have to know that there is one congenital scoliosis, and if properly detected in the fetal stage, you may either think about early abortion if the deformity could not be corrected, or if it is detected, we can properly treat as early as possible. So early treatment of scoliosis is also very important to prevent the severity of progression of the curve, to prevent truncal decompensation, to improve the quality of life by maintaining a good thoracic volume, which means that when the child is growing, we need to treat the early onset scoliosis so that you have a good thoracic volume. That is, breathing capacity for the child should be good. So early detection becomes very important in congenital scoliosis. Now, coming to the second most common type of early onset scoliosis, usually they are syndromic scoliosis. Syndrome means basically there is a spectrum of defects present in the body. For example, it may be a collagen defect like osteogenesis imperfecta. It may be a defect in the basement membrane like Marfan syndrome. It can be a defect in other genes like storage disorders or mucopolysaccharidosis. So these are a spectrum of disorders which we call it as syndromic. Sometimes on another end, severe form of kyphoscoliosis or scoliosis can also occur in scenarios where you have neurofibromatosis. This is also one cause of scoliosis. Now, coming to the third type of scoliosis in early onset, it is usually neuromuscular, which means there are neurological problems or there may be problems in the muscle per se. Problems in the muscle, for example, muscular dystrophy, facioscapulohumeral dystrophy, Duchenne's or Becker's. These are all problems in your muscles which happen genetically. Or somebody may have a neurological issue, for example, a Friedreich's ataxia, which is a problem in the brain, or certain people may have peripheral problems such as polio or spinal muscular atrophy. So these are called neurogenic causes of neuromuscular scoliosis. And the fourth common type of early onset scoliosis. If you have ruled out all the other causes, it could be called as a idiopathic scoliosis. So these four types, that is congenital, neuromuscular, syndromic and idiopathic, constitute the early onset scoliosis, that is which happens less than 10 years of age. Whereas if you have ruled out all these causes and if the onset is above 10 and below 18, usually we call it as an adolescent idiopathic scoliosis. A lot of research has gone into what exactly causes adolescent idiopathic scoliosis, but still usually we are not able to find the reason. So remember, early onset scoliosis, adolescent scoliosis and adult scoliosis. Thank you for watching.